So.
Thank you, Mr. Chairman, and thank you, Mr. Secretary, for spending so much time with us. First of all, I want to thank you personally for deciding that chaplains would be able to minister in the conscience of their particular dogma. In the Coatesville, Pennsylvania VA clinic, you personally made that decision that they will be able to do that across the VA, and I appreciate that very much. I'm glad that you are refocusing the VA from an employment agency and a mortgage company back to veterans. I will tell you that we're used to in this committee the VA coming to us and telling us what inputs they have put, what they've done, what they've spent, but very little results, very little outcomes. So it's been a breath of fresh air today for you to tell us what you are actually achieving. And I know that you have responded to what we call the lies of the left multiple times today. They've used the word fear, they use the word lack of trust, and you have responded every time to it. You've also had to tell us what the law is, because we've heard, it seems to be an issue that my colleagues across the aisle have it hard to understand that there are laws of this land that you are going to obey as you provide for our veterans. The complexity of the VA is not worthy of a yes or no answer in most cases. And I applaud you for working through that with them. The only question I have for you, and take as much time as you would like, is you've answered several questions on the electronic health records, but we've been told that it was going to be $50 billion versus the $9 billion that we've already spent. Can you just share with us the plans going ahead and take whatever time you would like, Mr. Secretary?
I appreciate that. I wish I could, go into the entire, because we're now looking at out years of a contract that should have been finished in 28 as it was originally done, and that is, frankly, not going to happen. I don't think anybody on this committee would take issue with that. So what we're looking at is finishing up the contract under the terms we have now, and we're actually actively renegotiating and trying to get more out of Oracle and others from their side to see how we can do it. And actually, so far, they have stepped up and agreed to many things. As we go forward, yes, there will be a time as we look forward in how to implement this past that 28 time frame. As we go forward, I'm not at a position right now to say what those numbers would be, but they will be something that we'll share with the committee as we go forward. I weirdly wish we wasn't here at this point. This is an issue that it could have been handled a lot differently. I can't comment, and I know some discussion that we had earlier, which I respected, on the history of this program. I had no involvement in that, and so it may have gotten started bad, but I've been given the task of finishing it. I've been given the task of taking the mess and cleaning the stall, and so that's what we're going to do. I appreciate the work. Again, what was really also very disturbing to me, Congressman, is, and this probably emphasized more than anything what I'm facing as we try to make change at the VA. And that is what I've always known is that we've always done it this way before syndrome. And I've seen it across the board, and they come in, and when I ask questions, I feel like that have basically reverted back to childhood, and I ask why about everything. Because when I see stuff come in, like, well, why do we do this? Why is this happening? Why is this person not held accountable? And finally, I think our folks are getting to realize that I'm not just going to accept the answer that, this is what we need to do. We've had issues ranging from West LA. We've had issues ranging from, how we deal with our community care, how we actually, put in processes to make sure that our survivors are actually getting the care that they need. All this may not seem like the health records management system, but it is combined, because when I came into this, we had a VA who was basically, and I remember my first meeting on this, and I'm trying to be as transparent as I can be here. And then like I said, I just want you to know that when I first sat down with our people, it was basically, we can't move forward, we're not in a position, and we're not gonna make changes, and it's, everything's bad. And I said, well, that's not a workable position. It's not workable for this committee. It's not workable for the president. It's not workable for anybody. We're wasting billions of dollars here on a program that is not helping our veterans, and also right now is actually hurtful in some ways in the original rollout. So it took getting over that hump, and I'm very pleased to say that after the initial meetings, our staff and Dr. Evans, who I can't speak well enough about, because he took on the mantle, and he has been sort of unfortunately having to ride this through the storms, if you would, many times when nobody would listen and he was having trouble trying to get it through, he actually has taken that on. So I do appreciate his willingness to sort of redirect the team to say, how can we now get this to happen? And so your question sort of overlaps everything we've tried to do at the VA, is to say, look, let's take a fresh look at what we're doing and fresh look at how we're doing it and why we're doing it. And some things that may change. Other things may not change. Years ago, an older gentleman who was in the church that I used to pastor made a comment. He said, preacher, he said, I don't want you to change. He said, we're making some changes. He said, just always remember, he said, I'll support you and we'll work change. He said, but before you move a fence, know why it was put up. And I thought to myself, at the time, I wasn't sure about what he meant by that, and then it made sense, is, sometimes you don't know what's on the other side of the fence. And we've tried to do that all along, and this EHRM process is something that, why did we not get to where we are? Where was it at? And so we're now knowing why the fence was put up, and we're moving the fence to get it really where it needs to go. So it's an endemic, not just to this, but to other things as well.
Thank you for that, Mr. Secretary. Mr. Chairman, I yield back.